tonight. The reality of the financial crisis facing the NHS is being laid bare by the boss of one of London's biggest hospital trusts. He was recorded saying there's not enough money and staff are working too hard. Let's get more on this from our political correspondent Carl Mercer. Very stark comments.
Yeah, and fair play, you might think, Riz, to the chairperson of any organisation who's willing to engage with protesters who are waiting outside their annual general meeting. That's what happened yesterday. And even fairer play when they're not only willing to engage, but engage quite so honestly. Now, many people might look at what's going on in the NHS and say, well, I wonder what's really going on behind closed doors, what the bosses of hospitals really think. Well, let's have a look, because I think we get a taste of it here.
Yesterday, this man was on his way to a meeting, but he got waylaid by demonstrators who filmed him on the way in. He is Sir Richard Sykes, chairman of Imperial, one of the biggest hospital trusts in London. People in his position rarely speak this honestly in the open.
The NHS is suffering today very badly. And it always was. If you go back to 1948, it's gone through these periods when it's always been cash strapped. Today, it's really cash strapped. You know, 80% of trusts are now in deficit.
Like others, his trust is facing tough financial times and struggling to hit targets.
The capacity just isn't there at all. You know that it's a big problem. The waiting times are a big problem. Referral to treatment is a problem. And so, you know, this is happening not just here but throughout the country. The finances are very, very strict.
He was fully behind NHS staff, he says, are under pressure.
And so do we. So do we. They work extremely hard.
We absolutely agree
So
with
this
that.
belief that we're inefficient and not managing
We
it
absolutely
is a
agree
joke.
with that. We agree with that.
These people work 18 hours a day. They're unbelievably efficient.
I have never spoken against
No.
NHS.
And that's why. But we're killing them now. You know, this is the problem.
And on the crucial issue of money,
Nobody likes to tell the truth. Nobody likes to stand and say, look, there's a problem here. And the problem is funding. Yes? There is no money. And I can't get it.
with that, he left the meeting. His presence gone, perhaps. His words, though, will last longer.
As you say, Carl, very candid, and his comments follow similar concerns expressed by NHS leaders in recent days.
Yeah, and also, why should we care what Sir Richard Sykes thinks? A couple of reasons. Imperial runs 4 of the biggest hospitals in London: Charing Cross, St Mary's in Paddington, Hammersmith Hospital and Queen Charlotte's. He was also the former chairman of NHS London before he was removed by the previous Health Secretary, Andrew Lansley. And yes, we have heard these similar concerns, haven't we, over the last few days? NHS providers, which represents all hospitals across the country, saying there's not enough money in the system. Similar concerns expressed by Simon Stevens, the chief exec of the NHS. The government, of course, saying, look, yes, we realise there is a financial challenge within the NHS, but we are putting £10 billion more in.
OK, Carl, thanks very much. Our political correspondent, Carl Mercer.